About 15 million more people could be prescribed statin pills to cut their risk of heart attacks and stroke, according to new advice given to the NHS. Cardiovascular disease is the leading cause of death and disability in the UK, killing about 160,000 people each year. High cholesterol is a big part of that, playing a role in over 7% of all deaths in England. And that's where statins come in. They're cheap cholesterol-lowering drugs that the National Institute for Health and Care Excellence, known as NICE, says should be considered for more people. They are already some of the most commonly prescribed drugs in the UK, with millions of people already taking a statin every day. Currently, the advice is for anyone with a 1 in 10 chance of having a heart attack or stroke in the next 10 years to be offered a statin. But NICE says they should be offered to anyone with a 1 in 20 chance. As with anything, side effects are possible, and with statins, the most common are apparently muscle pains. But having reviewed new evidence on the safety of statins, NICE says that most people don't suffer serious side effects. Experts are quick to point out statins are not an alternative to a healthy lifestyle, and that smoking, drinking alcohol, lack of exercise, poor diet, etc. are all important risk factors. But as statins become more popular, we're asking if they've played a big role in your life, and maybe you're thinking, well, just take one to be on the safe side. Or is that not a very good policy with any medication? Email vine@bbc.co.uk, include your phone number, please, so we can get back to you. WhatsApp us on the long number 08000 288 291. Going to speak in a moment to a consultant cardiologist, Dr. Riccardo Petracco, but first, Fergus Walsh, BBC medical editor. Tell us then what's behind this.
It's about looking at how many deaths and severe disease you can avoid, and the analysis by NICE, which the guidance will cover England and Wales, says that although statins prevent tens of thousands of heart attacks and strokes every year among people with a higher risk of those conditions, it can do much more. I mean, these are the most prescribed medicine on the NHS. They cost just a few pence a day, and they've been around, Jeremy, for nearly 40 years. So they're the most studied medicines. And there was a lot of controversy about them around a decade ago, about the level of side effects and so on. But that's really mostly been put to bed. And so really it's about looking at tens of millions of people and saying, what is, given that the drugs are so cheap, if we analyse the risks versus the benefits, NICE says the benefits are there, and so that's why millions more should have access to them.
Will it not be costly for the NHS, regardless of the cheapness of them, because you're going to be giving them to so many more people?
No, the overall cost will be a benefit, because it would prevent, according to the NICE guidance, thousands and thousands more heart attacks and strokes. And that will ultimately save money because they are so cheap. The cost of cardiovascular disease to society is huge, and the cost of the drugs is tiny.
OK, stay there, Fergus. You've got Dr. Riccardo Petracco with us as well, consultant cardiologist at Imperial College NHS Trust in London. It's an interesting thought, this, Dr. Petracco. If there are no downsides, maybe over the age of 50, everyone should take them.
Well, Jeremy, yes, it's a good discussion to be had, because we know, as Fergus mentioned, that statins work for many years now. But it's always that a further discussion on whether who should be taking it. Should everyone be on a statin? And of course, there are cost implications, but also side effect implications, and you can't really give every single adult a statin. And one of the ways we choose to select people is by assessing their risk. And as I mentioned, the 10-year risk of above 10% is the traditional one. But what we have been noticing, studies accumulating, that the side effect profile is very low, and it diminishes the chance of people having heart attack and strokes in the future, and therefore saves a lot of money to the NHS. Perhaps more people should be having it.
Is there any way, Doctor, of saying, if you give it to 1,000 people who've got this 1 in 10 chance, you will save X lives? Can we give some kind of answer on that?
Well, we know on average the statins reduce the individual risk of events by about 30 to 50%. Yeah, but that's the individual risk. Now, if your risk is very low, 30 to 50% might be not very much. But on a populational level, that accumulates to mean a lot of people. So I think NICE estimates by increasing the recommendation from 1 in 10 to 1 in 20, as you mentioned, that perhaps around 2% of that population will be saved from a heart attack and stroke in the next 10 years. So there's a lot of people there.
Okay, Fergus, I suppose this sounds a bit thoughtless, this question, but if you don't die of a heart attack at 55, you go and live another 20 years and you die of something else at 75, and the cost of that on the NHS is greater, surely.
Well, this is about healthy life expectancy and keeping people in society healthier for longer. And the figure was from NICE that if you take 1,000 people with a 5% risk of cardiovascular disease in the next decade, you would prevent 20 cases of stroke or heart attack. So you've got to look at that. But I know, Jeremy, when you open your lines today, you're going to get people ringing in who said, I had terrible muscle pains. I can tell you, and when I stopped taking the statins, they stopped. Well, I have to point you to that. And all these anecdotal comments are important, and they're important to the individual. But if you look at the landmark study that came out last August from University of Oxford, looked at 155,000 people in randomized trials, it found that 27% who were on statins reported muscle aches or weakness, and 26.6% who were on placebo or dummy pills reported muscle aches and weakness. So they found that it was really only a tiny proportion of that there is an elevated risk of muscle weakness, but it's very, very, very small. It's very small, and that it disappears after a year.
Okay. So do you find that, doctor, when you with your patients, you put somebody on a statin, they come back and they say, I don't know, they've got diarrhea or their muscles are aching or something?
Yes, I think Fergus collected very, very precisely there. There is a lot of people with side effects from taking a pill, and statin is one of them, but a lot of these side effects are coming from the fact that you're taking a pill, the fact that they were told they have a high cholesterol, and all the package of being ill or alleged being ill by having a high cholesterol. But the statins itself cause very little serious side effects, particularly when you put in context the benefit that they offer of protecting your life from heart attacks and stroke. So it's a non-brainer, really.
Doctor, if somebody comes in and their heart vessels are almost closed with furring, with cholesterol, and they start taking a statin, will it clear the vessels? Does it work like that, or is it only ever preventative?
Great question. So the accumulation of such fat that you described happens over decades and many years. And all these studies looking at statins really follow patients up for a much shorter period than that. So what we know is the statins lower the event rates and lower the accumulation of such fat and prevent those blockages from rupturing, causing heart attacks. And very likely over many years, they will reduce the amount of blockages. But that reduction is much slower than you would imagine compared to the numbers of years that you've been having high cholesterol since you're born sometimes. And therefore, the benefit is really preventing the blockages, but also making them more stable and less likely to cause heart attacks.
Thank you both very much. Dr. Riccardo Petracco, consultant cardiologist at Imperial College NHS Trust in London, and Fergus Walsh, BBC medical editor.